occlusion of the basilar artery will result in locked-in syndrome. This is when a person will become completely quadriplegic and lose their ability to communicate with the world. They are still fully conscious and they are only able to move their eyes. Occlusion to this blood vessel over here will result in a stroke to the lateral-most aspect of the medulla oblongata located over here. This will result in numbness of the left side of the face, numbness of the right side of the body, as well as drooping of the left eyelid, a smaller pupil in the left eye, and the loss of the ability to sweat in the left side of your face. This is called lateral medullary syndrome. The same thing can happen if there's an occlusion of the posterior inferior cerebellar artery located over here. An occlusion of this blood vessel over here will result in a stroke to this part of the brainstem called the pons. It's called lateral pontine syndrome, and it happens as a result of an occlusion to the anterior inferior cerebellar artery. This will result in weakness on the left side of the face, and it will also cause hearing loss in the left ear. You can also develop some vertigo and ataxia. Your eyelid will start to droop on the left side, your pupil will also get smaller, and you will also lose the ability to sweat on that side of the face. And in the right side of the body, you will lose the ability to sense pain and temperature. An occlusion of this artery over here, called the posterior cerebral artery, will result in a stroke to the left side occipital lobe. This will result in blindness in the right side of your visual field.